Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about shingles. In particular, I will cover what is shingles, how you treat shingles, and how you can manage an episode of shingles more effectively. So we start with what is it? So shingles is a viral infection that causes a painful rash. Although shingles can occur anywhere on your body, it most often appears as a single stripe of blisters that wraps around either the left or right side of your torso. So shingles is caused by the varicella-zoster virus, the same virus that causes chickenpox. After you've had the chickenpox, the virus lives inactive in nerve tissue near your spinal cord and brain, and years later, the virus may reactivate as shingles. So while it isn't a life-threatening condition, shingles can be very painful. Vaccines can help reduce the risk of shingles, while early treatment can help shorten a shingles infection and lessen the chance of complications. So the signs and symptoms of shingles usually affect only a small section of one side of the body. These signs and symptoms may include pain, burning, numbness or tingling, sensitivity to touch, a red rash that begins a few days after the pain, fluid-filled blisters that break open and crust over, itching. And some people also experience fever, headache, sensitivity to light and fatigue. Pain is usually the first symptom of shingles. For some, it can be intense, depending on the location of the pain. It can sometimes be mistaken for a symptom of problems affecting the heart, lungs, or kidneys. Some people experience shingles pain without ever developing the rash. Most commonly, the shingles rash develops as a stripe of blisters that wraps around either the left or right side of the torso. Sometimes the shingles rash occurs around one eye or on one side of the neck or face. So the causes again, shingles is caused by the varicella-zoster virus. And anyone who's had chickenpox may develop shingles. After you recover from chickenpox, the virus can enter your nervous system and lie dormant for years. Eventually, it may reactivate and travel along nerve pathways to your skin, producing shingles. But not everyone who's had chickenpox will develop shingles. The reason for shingles is unclear, but it may be due to lowered immunity to infections as you grow older. Shingles is more common in older adults and in people who have weakened immune systems. Varicella-zoster is part of a group of viruses called the herpes viruses, which includes viruses that cause cold sores and genital herpes. Because of this, shingles is also known as herpes zoster. But the virus that causes chickenpox and shingles is not the same virus responsible for cold sores or genital herpes, which is a sexually transmitted infection. Next is, are you contagious? So a person with shingles can pass the varicella-zoster virus to anyone who isn't immune to chickenpox. So this usually occurs through direct contact with the open sores of the shingles rash. Once infected, the person will develop chickenpox. However, and not shingles. Chickenpox can be dangerous for some people. Until your shingles blisters scab over, you are contagious and should avoid physical contact with anyone who hasn't yet had the chickenpox or chickenpox vaccine, especially people with weakened immune systems, pregnant women and newborns. So next is, how do you treat it? There's no cure for shingles, but prompt treatment with prescription antiviral drugs can speed healing and reduce your risk of complications. And the medications for this include Zovirax and Valtrex. And shingles can cause severe pain, so your doctor may also prescribe anticonvulsants such as Neurontin and tricyclic antidepressants such as amitriptyline and numbing agents such as lidocaine, which can be given as a cream or a patch, and medications that contain narcotics such as codeine and injections of corticosteroids. Shingles generally last between 2 and 6 weeks. Most people get shingles only once, but it is possible to get it 2 or more times. So how do you live with shingles? Taking a cool bath or using cool, wet compresses on your blisters may help relieve the itching and pain. And if possible, try to reduce the amount of stress in your life. And to prevent shingles, there's 2 vaccines may help prevent shingles: the chickenpox vaccine and the shingles vaccine. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist in managing illnesses more effectively on a day-to-day basis. We have various supplements and products which you can purchase from us without a prescription for shingles, such as antihistamine creams and antihistamine tablets and painkillers. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. So you can book a 30-minute clinic with us and we help increase your understanding of your illness. During a clinic, we create a cohesive management plan which enables you to take a more active role in managing your illness with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.